very different now than it was before. In the beginning of COVID, if I take us all the way back to January, February, and March of 2020, which is when we all started, the virus was much scarier than it is now. So we have adapted and learned from watching COVID that we know that it's not as scary as it was before. So we've adapted to that. We've changed. We as healthcare nurses, doctors, and technicians, we were frightened by COVID, and so we did many things that we had never done before in our career, where we were very careful. We had to wear protective equipment that we had never worn before. But as the virus progressed and changed, it became less scary. Well, that's kind of a tough one because we can only adjust to what we know. We went through lots of changes as the Center for Disease Control, the CDC. They were our main scientists that were helping us. We don't really do anything differently now with the information that we know that we did when COVID was really bad in the beginning. So what we do is we wait for the scientists at the CDC to tell us what level of precaution or care that we have to take to protect ourselves and to protect the patient. And when we responded to what the CDC did then, that's the same thing we do now. So what I mean by that is, let's say there's a new virus that comes out next week. So next week out comes some new virus. We would do the same thing we did for COVID. We would wait for the CDC to give us instructions about what the scientists have tested or what they know about how to protect ourselves and how to protect the patient. And then we have protected ourselves against other things that have been threats. Now, most people never talk about AIDS anymore, but AIDS was just as scary as COVID to the healthcare nurses and doctors when it came out. And again, we listened to the CDC and the scientists, and we followed how to protect the patient and how to protect ourselves. What we've taken away from this is that we have to really understand the science behind it, and then we have to learn how to adapt to it not being as scary, and then start to feel like we're becoming normal again.